Hello and welcome to the Institute of Hospitality webinar series, This Is Us. This webinar is featuring our business partner, PHS Group, and I'd like to introduce Brian Wilkinson, who's the head of HoReCa Retail and Leisure, which is covering the whole of the hospitality industry from PHS Group, and Elsa Forbes, who is Retail Impact Fellow from the International Longevity Centre. Over to you, Brian.
Thank you. Good afternoon, everyone, and thank you ever so much to everyone at the Institute of Hospitality for inviting us to this webinar today to present and discuss our Dispose with Dignity campaign and the white paper that we have commissioned in partnership with Prostate Cancer UK. Next slide. My name is Brian Wilkinson, and as mentioned, I head up the whole HoReCa and hospitality sector at the PHS Group, covering all of our major hospitality, retail and leisure customers. And I'm also delighted to be joined today by Elsa Forbes from the International Longevity Centre, who will also be updating us on how they are supporting us and their key initiatives from a retail perspective. Next slide, please. So what are we going to cover today? So as far as the structure of today's presentation, Elsa is going to firstly cover the International Longevity Centre's Retail Impact Project, why toilets are so important in retail, hospitality and leisure, and the consequence of not providing the correct facilities. I'll then go on to cover how PHS are committed to making a difference to male urinary incontinence, and going through some of the findings from our Dispose with Dignity white paper, and looking at some of the research that we've seen and ultimately what we see as the solution. So without further ado, I will pass over to Elsa.
Lovely, thank you, Brian. So as Brian said, I'm Elsa Forbes. I'm the Retail Impact Fellow for the International Longevity Centre, and I'm delighted to be able to present this introduction into this crucial issue entitled Why Toilets Matter. Firstly, I'd like to welcome this white paper. It provides illuminating data and rich testimonial evidence, which does fuel this much needed conversation, lifting the lid on these debilitating taboos. Could you pass the next slide, please, Laura? Thank you. So just a little bit about the ILC. We are the UK's specialist think tank on the impact of longevity on society and what happens next. We are one of the founding members of the ILC Global Alliance. So we have an international network all about longevity with members across 16 countries. And we want a society where everyone can thrive regardless of age. We are about what happens next and our societal considerations and actions which will define us for generations. So we have a very broad-reaching remit. And also just to say, it's very poignant to be presenting on this issue. Our founder, Baroness Sally Greengross, who sadly passed away earlier this year, was co-chair of the all-party parliamentary group for bladder and bowel continence care. And the aim of the group, which I'm part of now, is to break the taboos by raising awareness of bladder and bowel continence for adults and children. So it's wonderful to be able to present some findings and information to you. So the next slide, please. Thank you. So just a little bit about the Retail Impact Project at Thrive, Not Just Survive. One of our 4 aims is to encourage high streets to help us be healthier and be active around town centres, and sell us products that keep us healthy. And positive changes to retail environments can potentially help us be healthier as we age. We want retailers to better understand the evidence about what healthy aging means and transform how the retail sector sees, employs and serves older customers. And our high streets can play a great role in tackling things such as loneliness and helping us to all live more healthily. The next slide, please. So our three key messages here really are why toilets are so important, especially in retail, hospitality and leisure. And these are the things that we're going to be exploring shortly. The consequence of not providing toilets, and also additionally not having the right facilities within those. And then what are the solutions? Next slide, thank you. So why adequate toilets are so important, especially in retail, hospitality and leisure. And just to give you some contextual information, public toilets numbered around 14,000 in 2018 in the UK, but obviously that's plummeted with the event of COVID. Many have closed down and have not reopened. And local authorities are not legally required to provide any public toilets at all. So we often have to rely on toilets within hospitality and leisure, and often feel the need and the pressure to buy something in order to use the toilet, or to plan in advance, knowing where the toilets are on our journey before we go out of the door. So not having a wealth of public toilets that are functional and are able to satisfy those very important needs is extremely detrimental. The next slide, please. Thank you. And I think that these are all pretty clear points. Toilets are a human necessity and vital to a healthy life. They perpetuate our entire working and social life, ensuring that we can study, we can shop, we can live, we can earn money and socialise. And we rely on toilets outside the home to let us do the things we need and want to. They're vital to longevity, and they are a life necessity that helps us just get on, live our lives and do those things. The next one, please. Thank you. And the consequence of not having access to toilets and the right facilities within them. Well, there's a bullet points there which really need to be addressed. Not having this access and not being able to dispose of hygiene pads, etc., means that we lose dignity, we lose confidence. It's a lonely place to be. It increases social isolation for fear of not going out, or going out and being able to not find a toilet, or a toilet being closed. And this increases anxiety. The ILC released a report last year about spending with dementia and making the high street dementia friendly. And there was a testimonial in the report that said a father with dementia would urgently need to use the toilet on arrival at the shops, just because that was such an anxious transaction going from home to the shop. And even if the dad and his carer had planned ahead, this was adding to both their anxieties for a simple trip out, which just isn't fair. The next slide, please. Thank you. So the consequence of not having toilets and the right facilities means that there is a disproportionate group, much wider than you would initially think, that need access to toilets. And as well as that list that you see in front of you, which includes outdoor workers, truck drivers, the elderly, homeless, let's not forget pregnant women, women with young children, tourists, women on their period, and people with digestive conditions such as irritable bowel syndrome. All of these different and diverse groups of people all need simple access to a clean toilet which has all the essential components. And the report, the white paper that you've brought out also highlights that 1 in 5 men surveyed experienced urinary incontinence symptoms as early as between the ages of 18 and 25. I know Brian will expand on this further. And to deem that group of people with such a lack of dignity, again, society needs to look very carefully at this and change. The next slide, please. Thank you. In a 2016 paper, there was qualitative research which showed that customers actively changed their supermarket choice due to the consistency of the toilets there being frequently out of action and unpleasant to use. And here we start to see the commercial case for retail waking up and looking at this with some serious degree. Age UK's first top tip for age-friendly business was also to provide toilets and seating, essential facilities that give some people the confidence to go shopping at all. And what a difference we would make to people's lives if they were able to be guaranteed a toilet with the correct facilities. So in the report, the white paper that has just been released, there was an extremely interesting testimonial from Steve, who said businesses should get on board because they are alienating people who would become loyal customers. So again, that's another reinforcement of what a clever commercial decision it would be if retail was to adopt bins within their toilets. The next slide, please. So we don't profess to have all the solutions, and apart from the obvious installation of sanitary bins into men's cubicles and local authorities creating a commitment to building new toilets, there are different points that we can raise as potential solutions. If the next slide, please. So we have the first point about increasing awareness and challenging taboos, and I think the white paper definitely goes to starting those challenging taboo conversations. Increasing awareness, we've put a point about how inexpensive it is for a council to implement 11 bins into men's cubicles, and they also amended their cleaning contract for that small sum of money. And I hope that illustrates that this isn't about a really expensive scheme. It is inexpensive. Changing legislation, at the moment, currently, legislation states that businesses must provide all female toilets with a suitable method for sanitary waste, but this does not include men's toilets, and it's a very simple solution that needs to change. That legislation needs to cover male and female cubicles. And addressing the environmental impact, it's really important that we deter pads from being flushed down toilets because of the environmental waste. And there was an interesting quote from Kate Metcalfe that said if Henry VIII had been wearing a pad at the time, it would still be in landfill now. So this shows about the poor longevity of disposable pads, for example, and what we need to do collectively as a society to make sure that men are able to dispose of their the sanitary waste with dignity. We also have the economic opportunities that I spoke about earlier. Better customer toilet provision in commercial environments may encourage people to visit. So that's been recognised by Kemi Badenoch, MP, and we hope that she would be able to build and support businesses with changing legislation. And then finally, culture shift. We also need to think differently about how our nighttime economy, for example, operates. And it might mean that public toilets don't close when shops close. They stay open as a facility for people to access toilets. Next slide, please. Thank you. So also pushing the agenda, there is some movement in this area. And just to sum up, the government did introduce in 2021 100% business rate relief for public toilets in England and Wales. They declared them as public amenities, and that is certainly a step forward. But obviously going from 14,000 toilets in 2018 to an unknown quantity now, we know that public toilets need to be built, and this needs to be expanded. A toilet commissioner is about to be appointed by the Department of Health and Social Care, which is good news. So there will be somebody within the government to look at this agenda closely. And then finally, Carol Russell of the London Assembly Health Committee demanded that all levels of government should have a duty to provide public toilets, and she called on the government to make the provision of toilets compulsory. Last slide, please. And just to show this interesting example of revolution in toilets. This is a retail outlet called the Japan House, sorry, and they had a men's sanitary waste bin there, and there was also a bidet and a warm seat as well. So the creme de la creme of toilets does exist, and wouldn't it be wonderful if we were able to have more good examples of these. So thank you for your time, and I'm passing back to Brian. Thank you.
Thank you, Ailsa, and yeah, we look forward to obviously continuing to work with you, lobbying government on this matter in the future. So thank you very much. So right, moving on to PHS. So who are we? Yes, we're PHS Group, and yeah, we like to do the right thing in our business space. We are the leading hygiene service provider in the UK, Ireland, and Spain. And therefore, we believe it is our responsibility to set benchmarks and standards to drive change and innovate. PHS Group is therefore proud to commit to shining a light on the issues that matter but are not always talked about. As a business, we aim to be innovative by developing the best services and products that make lives easier. We're also passionate about removing stigma, raising awareness and breaking down barriers on subject matters that are often shied away from. Historically, male washrooms lack amenities, especially when it comes to the disposal of hygienic waste such as incontinence products. Tackling the taboo and protecting the environment, we know what men need when they visit the washroom, and we are driven to provide facilities that will enable all men to dispose of their incontinence waste with dignity. Hygiene and washroom services is our day job, so we're in a perfect position to raise questions around the issues faced in male washrooms. We're therefore extremely excited to launch the Male Incontinence Dispose with Dignity white paper that provides an in-depth insight into the taboos surrounding male incontinence, washroom inequality, and what men think about dealing with incontinence in public washrooms. And we will touch upon some of our research findings in this webinar. Next slide, please. Our partnership with Prostate Cancer UK demonstrates our total commitment to helping men experiencing incontinence problems through their prostate cancer treatment. We want to work together to become a catalyst for change. One of our key objectives is lobbying government for such a change in legislation to ensure that men have the same access to facilities to dispose of their incontinence waste as women do for sanitary products, and thereby ensuring that everyone has discreet disposal for all. Furthermore, PHS have donated to our charity partner Prostate Cancer UK to help fund the research and development of a much needed prostate cancer screening programme. Next slide, please. In the UK, it is recognised by the NHS, who estimate that between 3 to 6 million people in the UK suffer with some degree of urinary incontinence, with a third of men over 65 affected. Our research in targeting 2,000 men of all ages found a prevalence rate that was much higher than the above figures, with more than half of our sample stating that they experienced symptoms associated with urinary incontinence. Next slide, please. Significantly, the belief that this is only an older man's experience was actually shattered in our research, with 1 in 5 men stating that they had experienced these symptoms as early between the ages of 18 and 25. Clearly, this is therefore not an age group where urinary incontinence is expected. So finding this out from so many younger men was indeed shocking and needs further research and understanding. Our research also found that there was a high lack of knowledge and a low level of awareness of the prevalence of male urinary incontinence. Indeed, nearly 3 in 5 people did not know that men over 55 commonly experience this condition. The actual reality is that 1 in 25 men over the age of 40 experience it each year, and this figure dramatically rises to 1 in 3 men when you're age 65 or over. Our research also showed that 25% of our nationally represented sample were unsurprised to learn about the extent to which men's lives in the UK are impacted by urinary incontinence, which therefore meant that, on the contrary, that 3 in 4 men sampled were actually unaware and surprised about the scale of the problem. Next slide, please. As part of our detailed research, we also separately polled a group of 500 men. They were asked about their challenges that they face when using public washroom facilities and the availability of dedicated bins for disposal of incontinence products. Over a third of men had found it hard locating a bin in a public toilet to throw away used incontinence pants and pads, while almost 1 in 5 reported having a really bad day-to-day experience when out and about because they were rarely able to find bins in any kind of public toilets to dispose of their incontinence products. We found in our research that anxiety and isolation are prevalent for many men with urinary incontinence, and of those who had experienced poor facilities, 2 in 5 men said that they feel anxious about using public toilets. Over a third leave the house less often. Almost 8 in 10 men stated that they feel anxious about the lack of facilities when leaving their home. It should therefore come as no surprise that more than 1 in 4 men actually feel depressed about the impact involuntary urinary leakages have on their life. And with this figure soaring to 100% for men in the younger age bracket of 16 to 25. Across our research, it was clear that men employ a number of different strategies to overcome the near certainty that they will not be able to find a facility to dispose of their pads when it comes to going out in public. These included 38% of men taking a bag out with them to dispose of used hygiene products until they got back home, 34% asking their female partner to keep used hygiene products in their handbag, 32% of men wearing product longer than advised to, which could cause further health risks, and 25% acknowledging that they have actually resorted to flushing these pads down the toilet. 18% of men who have used public toilets in the past will only visit places they have been to before to ensure they have access to the facilities that they need. Possibly due to this lack of provision, the majority of men have used disabled toilet facilities to dispose of their incontinence products. They acknowledged that they did not class themselves as being disabled, which ultimately made them feel embarrassed and self-conscious when using the disabled facilities. Men were also very keen to see government legislation put in place, ensuring that adequate facilities are provided in male toilets and more the provision of male incontinence bins. In terms of what else men were looking for alongside this practical support, they also said that they would welcome increased public awareness of their condition. They would like to see more openness in discussing this issue, and 34% would like to see increased funding for scientific research into the treatments and the cure for urinary incontinence. But commonly, 7 in 10 men with an incontinence condition stated that they would be more likely to use a restaurant or business if they knew it was supporting a scheme for the provision of male incontinence bins or incontinence products in washrooms. We can also assume that some of these men will be accompanied, or would have been accompanied, by friends, family members and children, all of whom would have spent money whilst in the establishment of their choice. Thus, we firmly believe making it a sound business decision to invest in the provision of male incontinence bins, which could potentially provide you with a return on investment. As mentioned by Ailsa earlier, we also have some supporting case studies to back up our research from actual male urinary incontinence sufferers, and one in particular from a guy called Steve Bourne, who references how he suffered so much with anxiety due to his incontinence problem that he actually stopped going out altogether and became a bit of a recluse because of the lack of provision for him to dispose of his waste products. How many more men in the UK do this? And how many potential spending customers and their families are we losing out on? From a customer perspective, this campaign commissioned by PHS and Prostate Cancer has been taken up really positively. We've had some really positive feedback from customers, and so much so you had some of the largest customers in the UK in their fields wanting to get on as early adopters and roll out our incontinence bins across their estates. And one such customer, as you can see from the slide, was Moto, who are the largest motorway services operator in the UK, and one who, it's probably one of the main reasons why we stop at these places is to use the toilets. So very important to Moto and to their Chief Customer Officer, Nick Tatum, who wanted to get on board with this campaign straight away, told us to put a incontinence bin in every cubicle, in every service station, because to them it was all about making sure that there was no discrimination, that there was dignified disposal for all, and that was their mantra in rolling out this solution. And to be fair, we would like to see exactly that same attitude across all businesses in the UK, and because we should adopt this methodology to provide staff well-being for both our customers and our staff. Next slide, please, Kate. So in summary, our research into male urinary incontinence puts a subject not often talked about right under the microscope. It's drawing attention to the issues, and it's starting a conversation that we would like to see leading to action. It's absolutely clear that these discussions need to happen now for this to gain momentum and for it to be followed up by robust measures to help support the multifaceted and complex needs of incontinent men. It is actually time for men to be afforded the human right to dispose of their incontinence products safely, hygienically, and with dignity in a male toilet, and not be forced to use a disabled toilet, ask a female partner to dispose of it in their toilets, or carry their pads around with them until they find a suitable bin in public or at home. So thank you ever so much for listening. We hope that you found this useful. You will see both mine and Ailsa's contact details on the slide in front of you. There's also our PHS QR code on there that will take you to all the necessary literature and collateral around our campaign on male incontinence and how we're supporting prostate cancer in our white paper. So please feel free to review those documents as much as you can. And yes, thank you very much for your time.